age are likely to suffer greater economic and social impacts during any crisis. The current situation due to the pandemic also testifies to this reality. That is what is visible or evident in many places in Asia where women bear the brunt of the impact of the COVID-19 crisis, especially the severe economic and social impacts. Across the globe, we know that women earn less in every situations and context, and they save less. They hold normally less secure positions in their jobs. They are mostly employed in informal sector. Often they have less access to social protections. An increasing number of women are breadwinners for single parent households in many parts of the world. So the situation in Asia is not different from of this in normal times, but now during this particular crisis period, it is actually increasing. Our experiences in our day-to-day lives show that domestic, sexual, and gender-based violence increase during any crisis situations and whenever any disasters happen. So the situation emerged out of the COVID-19 crisis is not totally different. The effects of the lockdown, especially increasing domestic violence, are among the factors that may be contributing to higher rates of stress and anxiety among women in Asia. Then the issues related with the school closures due to the lockdowns. Automatically, this is translated into extra burdens for women who are normally responsible for childcare in Asian context. So when most of the industries in the formal economy directly affected by quarantines and lockdowns are especially in sectors such as travel, then tourism, restaurant, food industries, where normally the female labor forces are in large numbers and they are the main breadwinners in their families. Many of them lost their jobs ever since the lockdown was introduced by different governments in different countries. So the same is the case in the areas of informal economy, especially in marketplaces, then in agricultural areas, in rural areas, in many parts of Asia where women constitute a large percentage of the workforce. Women represent the majority of the health workers and social workers who are in high risk category due to significantly higher exposure to the virus as part of their job. In these contexts and many other contexts that we will be discussing the impact of COVID-19 crisis on women in Asia. So various aspects of this theme and different issues identified in relation to these issues will be the focus of our discussions in the next 2 hours. The structure of this webinar is divided into 5 segments that will cover 5 different or specific aspects of the main thematic focus. The first segment will focus on the impact of COVID-19 on women in Asia, an overview. The impact of COVID-19 across Asia are profound, and the impact of this crisis on women has multiple levels. An overview of the situation will be shared with us by two panelists, Ms. Melissa Alvarado, who is a senior UN official working with the UN Women Asia Pacific office, regional office in Bangkok. And also Ms. Maya Dania. Across every sphere, from the health to economy, security to protection, social protection, the impacts of COVID-19 are exacerbated for women. In this context, how can we assess the impact of COVID-19 crisis on women? We shall start with Ms. Alvarado. May I request Ms. Melissa Alvarado to start your presentation?
Thank you so much. It's such a pleasure to be with you today. It's a pleasure to be part of this esteemed panel. So thank you for convening the discussion. We, of course, at UN Women are very much committed to all the things that you've just spoken about. You've really highlighted and framed some of the issues that we are looking at with increased scrutiny every day. So what I'm going to start with doing is sharing some of the highlights from an analysis we've recently completed on the first 100 days of COVID in Asia and the Pacific, and looking at what are the gendered impacts. So we've really looked at COVID from a gender lens. And we found several main themes regarding the impact on women and girls, and I'm going to highlight 4 of those here today. The first point is related to security. We know that the security sector has been mobilized to enforce emergency measures and movement restrictions in countries across the region and around the world. This brings many challenges when interacting with women and girls. In Asia and the Pacific in particular, law enforcement is predominantly male, with a severe underrepresentation of women in the police and the military. We understand that women represent only 6% of police and the military here. And that brings risks, unfortunately. Potential risks in terms of human rights violations, misconduct, gender-based violence, such as sexual exploitation and abuse. And those are concerns in crises just like this one. And we've learned from previous crises that we have to pay attention to this. We know that security personnel are supporting maintaining peace and social cohesion. Those folks have, in many cases, been redirected to contain the virus. And women and girls who are already feeling vulnerable in conflict settings or in other settings where they're not feeling safe may face further threats to their protection. And so it's really important that our police and security personnel can be sensitive to the needs of women. There can be women for them to talk to if they do face difficulties. And so that is an issue that we know needs an additional attention and more women in those workforces. The second point I want to underline is on violence against women and girls. Many of us are seeing the news. There's very alarming, frightening, frankly terrifying stories coming out in the media about violence against women and girls during this COVID epidemic. And we know that during times of crisis and emergency, including from previous epidemics, that gender inequalities can worsen and intimate partner violence can increase. We often call this domestic violence. And so we see that this is now what's unfolding in COVID. We expected, unfortunately, that this might happen, and that's what we're seeing unfold. And we know that being able to address violence against women right from the start of any emergency is essential and it's life-saving. And so we often talk about the need to include this right from the start in national level, local level response and prevention plans. It's not something that we can put off till COVID is over. And we also see that life-saving care and support to survivors of violence may be disrupted and is being disrupted right now, such as in the case of frontline service providers or systems, such as health, policing, social welfare being overburdened by dealing with COVID and preoccupied with handling those cases. And it's a major issue. However, it also is diverting resources away from survivors of violence when they've been harmed or they're in further danger. We've heard from some women that they've gone to police stations or to hospitals, and they've been told, not right now. We can't take you right now. Please come back after COVID. And this is unfortunately not a reality. It's not possible for some women who've been harmed and whose lives are in danger. We hear that shelters have been closed, and this is in fact a life-threatening issue for many women. And because I'm today speaking to this faith community, this Christian community, I want to highlight one interesting development that's happened, that's unfolded in the Pacific region. We cover Asia and the Pacific from where I sit here in Bangkok. And what's happened there is that we have developed over many years a very strong cooperation with the Christian and faith communities there to specifically address violence against women and girls. We're working closely with the Pacific Conference of Churches and faith leaders of various denominations in Fiji Islands and the Pacific Island countries, Christian, Muslim, Hindu faiths, to prevent violence against women, to communicate that this is never okay, there's never any excuse to commit violence, and to work through spiritual teachings and theology to understand what those communities can do to communicate that violence is never acceptable and there's other ways of dealing with conflict. And so that is really essential work that we see incredible promise for, and we're very excited to see that unfolding. Now, I want to come to our third point in this 100 days gender analysis of COVID, and that is related to women and the economy. You know, as you mentioned already, the socioeconomic impacts of the pandemic are really hitting women the hardest, related to social and economic inequalities. Now, we knew that there were inequalities before, and now that's in fact just getting worse. We know that there's legacies of women being left behind in education and access to opportunities, information, credit, employment, coming to the forefront as these economic impacts unfold. And I'll give a couple specific examples now. So related to the private sector, we see increased care burdens coupled with sort of gendered expectations in families about working women. And women are more heavily concentrated in direct service jobs that cannot be done remotely or are deemed non-essential. So that means women are at home, they're taking care of families, and they're not able to perhaps find other work in this moment because they have all these care responsibilities. And COVID has really revealed to us how much we need to be rethinking care responsibilities at home, whether that's with children, whether that's household responsibilities. All that's really come up as a big issue to look at and to really find ways to rebalance what men and women are doing in households. We also see that there's unfortunately an important economic cost of the increased domestic violence. Workplaces and companies are really starting to pay more attention to this because unfortunately, COVID has really brought forward the fact that many people are experiencing this issue right now. We now have a greater view into people's homes. We see the stress and tension that they're experiencing. And this frankly has also an impact on operations of companies, you know, and actually business continuity. We also know that women are disadvantaged in emerging tech-oriented and work modalities. As we're shifting towards, you know, online and remote work, access to technology and digital skills is essential right now. And this is where women are falling behind. Women have already been falling behind. And we need to be, and they also are excluded from new opportunities that are being created. And so a combination of women's time constraints being, you know, because of household care responsibilities, coupled with lack of technology education or access to devices such as phones and computers, something so basic, is actually preventing women from becoming more present in the workforce and to re-enter workforces. And so we know that women are also underrepresented in some of the areas in sectors like technology, e-commerce. And in these fields, we know that unless women are really brought in quickly, we're going to see major changes in women's ability to be part of these workforces. I want to underline here that there are certain groups of women, and you've already highlighted this, that are facing enormous challenges. Migrant women are a large part of that group. And so we see migrant workers in domestic work, care work, construction, agriculture, factory work, and hospitality that have been unable to telecommute. Many of them have lost their jobs, and this is, and they're also facing increased risk to COVID because of some of their living standards, living in informal settlements, for example, or living at workplaces. Some are finding themselves quickly out of work and then stuck because of visa issues. Now, quickly, I will touch on the last point, which is on gender and disasters. So we know that the Asia Pacific region is the most prone to disaster impacts in the world. Countries are grappling with natural hazards that are unfolding right now. There's a drought in the Mekong where we see that women's burden for household care and even water collection is challenging their time and their ability to be part of other recovery efforts. And we're also seeing that in the Pacific, there's tropical cyclones have unfolded, and that's creating challenges for people to maintain balance and maintain their well-being and health. So overall, COVID is having an enormous impact on women and girls, and we see urgent needs to engage women as decision makers, as leaders, to be able to be part of the solutions, to rebalance what happens at home, and to make sure women are coming full force as part of the recovery, the social economic recovery efforts. I will stop there. Thank you so much.
Thank you very much. Our second panelist in this segment is Miss Maya Dania.
Yes, thank you.
Maya comes from...
Okay, I come from Indonesia, but now...
Introduce you. Wait a minute.
Okay.
Maya Dania comes originally from Indonesia, but currently she teaches at the Mae Fah Luang University in Chiang Rai in Thailand. The question or the questions she will be addressing to us includes: how has the COVID-19 pandemic spanned
the violences? That's from my side. Thank you so much.
Thank you very much, Nirmala. The second panelist in this segment is Ms. Sotheavy from Cambodia. Ms. Sotheavy is director of the Alliance for Conflict Transformation in Cambodia. She will be sharing with us the situation in Cambodia on how has the COVID-19 situation affected women and young girls, especially those who are working in the textiles and service industries where predominantly more women workers in Cambodia. So Ms. Sotheavy.
Yes, good afternoon, everyone. Thank you, Dr. Matthew, for giving such opportunity for me to share about the situation of COVID crisis on women in Cambodia. As you know, that more than 2 million Cambodians currently have loans with a microfinance situation, and many levels of debt have a very high skyrocket in recent years. That leads to a number of human rights abuse, including land sale, child labor, debt revenge, migration, and bonded labor throughout Cambodia Northeast. Mostly widespread microfinance debt is pushing families from their homes to work across the Thai border. So due to the COVID pandemic, around 80,000 migrants have returned to Cambodia from Thailand. This sudden loss of income put a family at risk of further human rights violation to their microfinance debts, including being forced to sell land in order to repay their loan. Formal and informal workers in Cambodia, manufacturing, construction, entertainment, transportation, and tourism industry are all facing severe job loss as the nation economic slow amidst the global pandemic. Far too many families have had leave their home and their country to repay microfinance institutions. Human Rights Watch few months ago has documented because there was 17 people was arrested due to sharing information about coronavirus in Cambodia. Those 17 people, among those, there are 5 women. Those charged face penal code violation, including incitement, conspiracy, and spreading false information. The authority also arrest and question 14-year-old girl who expressed fear on social media about the rumor of the positive COVID-19 case at her school and in her province. 12 were released from detention after signing pledges to not spread a fake news in the future and to apologize to the government, to the public. Early of this month, a group of NGO seeing all those human rights abuse, a group of NGO and CSO had signed decries the harassment of the community representative from across Cambodia on the situation on April. The community representatives were arbitrarily detained for several hours and interrogated while trying to submit a petition asking for additional government assistance to vulnerable community during COVID crisis. So more than 30 community representatives from across Cambodia gathered in Phnom Penh to submit the petition, which has life-saving questions such as asking the government to distribute the medical supply to vulnerable community, suspend debt from microfinance institutions and private money lender, provide direct economic assistance, including suspending rental fee for the poor and informal worker and providing stay-at-home payment. So during this process, the community representatives were repeatedly asked by authority, including police officer, what organizations were behind in the petition, who also the petition, and they were questioned about whether they really faced the problem listed. So many questions they had asked, and they focused on community member microfinance debt, and some representatives were asked about their personal finance situation and were required to provide a proof of debt in microfinance and to the district authority. So at least 2 community representatives were summoned and harassed after they returned home to their community by their local authority. These interrogations were inside and appear predict on the mistrust of local community who actively exercise their rights to freely express themselves. They ignore the reality that independent community across Cambodia have advocated for their rights for decades, in particularly around crucial issues such as land rights. So this harassment is unjustified and should never have taken place, particularly when the Ministry of Interior has repeatedly claimed that grassroots community have the right to conduct activity freely from the disturbance and in accordance with the law. So in end of April, the community representative also gathered again in Phnom Penh, but were denied permission to submit the petition to the Council of Ministers. They were instead directed by authority to Prime Minister Hun Sen cabinet, but the official there decided to accept petition because it was addressed to the Council of Ministers. So the copies was successful delivered to Ministry of Health and Ministry of Economic and Finance. So the petition was signed by 141 community and NGO across the country, and seek to address the health and economic impact of the COVID virus, which disproportionately affect vulnerable community in rural areas, as well as in Phnom Penh. It's not that the government seem such as ID poor are not yet comprehensive or fully affected, and encourage the government to take more holistic approach to fight economic impact of the virus. It also includes a call for immediate halt on all eviction during the COVID crisis in order to protect community members and authority from the virus. After meeting with the authority and police officer at the Hun Sen cabinet, 9 community members were asked by officials to discuss the petition further to the Phnom Penh district officer at around 3 p.m. Among 9 community, 6 are women. So they were detained in the district office for more than 7 hours, denied permission to leave, and were never provided legal justification for their detention. During their detention, they faced interrogation from authority until after 10 p.m. So some representatives were deliberately singled out and questioned individually, and they had answer compared to other representatives. So the interrogation techniques more commonly used on criminal, not peaceful petitioner. Some representatives were also ordered to unlock and hand over their smartphone and were questioned repeatedly about who authored the petition, as well as their personal finance relationship with a microfinance. At the end of interrogation, the community representatives were coerced into some print document and seeks to restrict right to continue advocate on behalf of their community prior to being allowed to leave the district office. These community representatives also have been welcomed by their government and treated with dignity, and while they share a legitimate concern of tens of thousands of community members across Cambodia, the community representatives set out with the intentions to inform their governments about the problem in their community and never demand anything other than request to be considered in the government response to the COVID issues in Cambodia. So in the second week of May, we found that some of the microfinance had responded and take action to accept the poor people request to delay a few months of the loan to the microfinance. This is not applied for all, only the poor which they have investigated requests to need of that. So though due to COVID-19, education institution in Cambodia had been ordered to close since the mid of March to prevent the spread of COVID, and the government extend school closure until further notice to fight COVID pandemic, and we never know when will they allow to open again. On mid of March, they also closed KTV, karaoke, club, cinema across the country in order to prevent the spread of COVID. And early of April, they also had closed all casino. That was affect a lot of workers, around 20,000 workers who lost their job. So COVID represents a massive global health, economics, and political challenges. It is both a gender challenge to women are a majority of healthcare workers intentionally take on more caregiving responsibility and disproportionately represented in informal and precarious work in displaced sites, women and girls face distinct risks due to protection gap in a sexual and gender-based violence and pre-existing weak health infrastructure. Gender across Cambodia self-granting and enforced lockdown increased the burdens on women as girls as primary care provider when combined with the indefinite and stress of confinement. This caused a surge in domestic violence. Poor, indigenous, and minority women that operate small business have reports significant loss of income due to COVID, placing enormous strain on their facility. So with this COVID, the related has been also a serious implication, both in short and long term. It makes those target more vulnerable to violence, expose them to political and social exclusion, isolation, and stigmatization, inhibit them from expressing themselves and participating in
these issues later.
Yeah. And deter them from accessing medical care and other vital services. In doing so, it is heightened the disproportionate effects of the disease on certain communities and exacerbate underlying social and economic inequality, aggravate driver of violent extremists while undermining the social cohesion, solidarity, and trust necessary to affect the tackle of spread of the virus. Yeah, it may also trigger social unrest in intergroups violation, possibly enhancing the conducts to conflicts and atrocity crime. So it is related more on hate speech. Many therefore pose a threat to enjoyment of human rights, sustainable development, and international peace and security. So thank you. That's about what happens in this country.
Thank you, Sotheavy. Our third panelist in this segment is Dikshaya Ilangasinghe, who is the director of South Asians for Human Rights, based in Sri Lanka. She is going to speak to us one of the other important aspects, the situation of women migrant workers who are more vulnerable during